Hi, and welcome again to Dr. Lord's Mental Health Matters. This is another short video in our Psychopathology in 60 Seconds series. And today we're going to look at obsessions and compulsions. Now, obsessions and compulsions are the two components of what psychiatrists call obsessive-compulsive disorder, and sometimes quite often shortened to OCD. I'm sure you've heard of it. So what are these two components? Well, obsessions are recurrent, intrusive, repetitive, unbeckoned thoughts associated with very significant levels of anxiety. So these are thoughts that intrude into the sufferer's consciousness. They're not willfully brought in or directed thoughts. They're intrusive. So in that sense, they're somewhat alien to the normal level of consciousness and thought processes. And they're often about themes of danger or imperilment or contamination, dirt, germs, generally themes that might have adverse or catastrophic outcomes. And therefore, they're very anxiety laden. They're associated with a mounting sense of anxiety as they repeatedly enter the mind and go round and round and round. Now, that then drives what we call compulsions. And compulsions, the other half of obsessive-compulsive disorder, are actions associated with those obsessions. And the actions are usually designed to reduce the anxiety about the theme of the obsession. So a classic example is the obsessional fear of contamination by either dirt, germs, or some sort of noxious substance, usually on the hands, and therefore the anxiety associated with that is assuaged by washing your hands. But the problem is with obsessive compulsive disorder is that the intrusive thoughts return again, and you feel you have to wash your hands again and again just to get rid of the anxiety about contamination with dirt, germs, or noxious substances. So the relief of the anxiety and the dampening down of the intrusive thoughts by the compulsive act of washing your hands only gives a temporary relief at best. Another classic OCD theme is one of causing accidents when you're out driving around in your car. So patients will be driving to and from work or out shopping, and they'll have these intrusive, repetitive, unbeckoned thoughts that they've caused an accident or led someone to have an accident behind them, and they've been injured or worse still died. And so the compulsive act to assuage that anxiety is to go back over your steps, retrace your steps, and just check that there's not been an accident or a disaster you've left in your wake. But again, the problem is that only gives a temporary relief from it, and a short time later, up to maybe only a few minutes or a few seconds, you can start to doubt things and worry again with these intrusive thoughts that you've still caused an accident somewhere else and you just didn't notice it, or on the next leg of the journey you've led to an accident. So it kind of goes round and round. The other really common example of this is intrusive thoughts about not having locked your door or your house up. So even though you made sure you did, when you get halfway down the road, a mile or two, you have to come back and recheck your doors and make sure you've locked up. Now, as you can see, these obsessions and compulsions differ from some of the things we've talked about in previous videos, like delusional thoughts. There's a very different quality to them. In obsessions, the sufferer has insight into the fact that they're rather irrational. They're not really proportionate to the risk and the danger in the environment. But nevertheless, they continue to intrude and create anxiety and demand compulsive acts to assuage that anxiety. Now, you can get obsessions occurring independently and on their own without the compulsive acts. That's a little bit rarer, but it does happen quite frequently. On the other hand, it's I wouldn't say it's impossible. It's very unusual to get compulsive acts on their own, because you kind of need the obsessional thoughts and the anxiety related to them in order to generate the compulsive act. So if it looks as if there's a compulsive act occurring on its own, you probably haven't searched hard enough for the obsessional thought component. Now, there are various degrees of severity of this, and at its mildest it can be just very intermittent and occasional bouts of this, but at its worst it can be an absolutely crippling condition in terms of the amount of time and energy and dominance in terms of your mental life that's taken up entertaining these intrusive thoughts and acting in a compulsive way. There are treatments. So we treat this with a combination of cognitive behavioral therapy and also different types of anti-obsessional medication, usually mainly from the antidepressant class of drugs, which also have strong anti-anxiety and anti-obsessional qualities. But also we occasionally use low doses of certain types of antipsychotics. In the old days, and still probably in some centres in really extreme cases, they do psychosurgery, so very, very precise and discrete operations on pathways in the brain. So I hope you've enjoyed that very brief, quick-fire rundown on obsessive-compulsive disorder and obsessions and compulsions. Till next time, see you soon.